Hi, I'm Dr. John Fluke. I'm Chief Dental Editor and Technology Editor at Dental Products Report magazine. And today I want to talk to you for a couple of minutes about a product that is near and dear to my heart, and that is the BioScreen from AdDent. This is a screening device for oral cancer, and as we all know, oral cancer is a tremendously important part of what we do from a screening standpoint. Oral cancer is something that we have a duty to screen for in our practices, and this device makes doing those screenings incredibly easy. So this is what I believe in, and this is what I tell my patients. I tell my patients that, oral health actually affects about 35,000 people a year. And a lot of patients think that the causes of oral cancer are smoking and alcohol use, and they looked for people imagine people being over 40, smokers, drinkers, people that probably don't live the healthiest lifestyle, and those are the people who are more susceptible. But that has all changed. Yes, years ago that was the case. Nowadays it's been tied to human papillomavirus number 16, HPV 16, and it's being transferred through sexual contact. And so what we're seeing is folks showing up with cancer in the tonsillar pillars, in the throat, lots of areas other than just on the tip of the tongue or the buccal mucosa. And that is why we need to screen for this. It's coming in younger people, and we need to screen for it. So what I tell folks is, this is not a detection device, this is a screening device. So what I'm going to do is I'm going to turn off my headlight, because I work with a pretty bright light on my scopes, and I'm going to take this and I'm going to move it around in your mouth and look. And the great thing about this is that in dentistry, we've always done oral cancer screenings, but we've normally done them with white light, and the mouth has a lot of colors in it. And so we would look and we would be like, gosh, is it supposed to be white there? Or, gosh, that's pink, but is that too dark a pink, or is it too light a pink? Or, that's rough, but should it be rough in that spot? There's lots of guessing games when we were trying to do the screenings. With this device, anything that needs to be followed up on appears black. So it takes a lot of the guesswork out of the exam for us. We simply look around at the tissues, and anything that we need to follow up with shows up black, and we can see it much, much easier. It's an easy thing to do. Tell my patients, I don't even charge you for this, because I just think it's something I should do. I don't want anybody to ever have to go through some type of life-changing surgery and perhaps be disfigured because I wasn't doing, what I needed to do to help you prevent that. And I tell them we don't charge for it. We do always make sure that it shows up, on the super bill at the end of the exam, so they see that we did perio probing, they see that we did an exam, we see that we did oral cancer screening. But this allows them to know we're doing this, and I think it's the right thing to do. I do this on every one of my patients over the age of 15 or so. And I think it's a great thing that we as a profession are obligated to do. I always make sure I tell patients what I'm doing, though, because I want them to know what I'm doing and why I'm doing it. I want them to understand the value of what I do, but I don't use this as a profit center. I use this as a way to showcase this technology and explain to them how it helps them. And that technology markets itself. So by doing the right thing, I don't think you can ever go wrong with that. I use this on a daily basis on every patient, as I said, 15 and over, and I think it's a great service to offer. It's the BioScreen by AdDent, highly recommended. I'm Dr. John Fluke. Thanks for watching.